Regarding opportunistic infection, the first pathogen is Candida albicans. Candida albicans. Candida albicans is the normal flora of the human body, and it is present in a dimorphic form. Like it at 37 degree, it turns into germ tube, and at 20 degrees centigrade, it turns it into pseudo hyphae and budding yeast. So Candida albicans in the immunocompromised patients, especially in the immunocompromised, it can cause opportunistic infection, and is one of the opportunistic infection causing pathogen. So Candida in immunocompromised, first we discuss how Candida causes. It can cause superficial infection and systematic infection. Superficial infection, whenever there is a decrease T cell immunity, then it is called then it can cause a superficial infection, because for superficial infection we have known that the dendritic cell, T cell, macrophages, the interlink between these three entities is very much important in order to cope up any superficial allergen or any superficial antigen. But when they are disturbed or they decrease level of T cell, then it can cause superficial infection. While in the body, whenever there is a decreased number of neutrophil, it can cause, like neutropenic patient, it can cause systemic infection. So first, in immunocompromised, like AIDS patient, like patient with inhaled steroids, like patient which are diabetics, and patient which are neonates having immature immune system, it can cause systematic problem, especially in it can cause oral and esophageal thrush. It can also cause a diaper rash, very common diaper rash in the neonates, and also it can cause in the females which are diabetics, which taking oral contraceptives, and also they are frequent antibiotic users. It can disturb the vaginal flora and cause vulvovaginitis. Vaginitis mean inflammation. Then in the neutropenic patient, it can also cause in IV drug abusers, and also in the patient which are on the central venous on the CVP and taking a total parenteral nutrition, it can cause endocarditis. One of the causes of endocarditis. After that, in neutropenic, in systemic, for systemic infection, the patient must be neutropenic, or there is a immunodeficiency. Then it can cause disseminated or systemic infection, and also causing a chronic, we have known that chronic muco in immunodeficiency segment we have discussed that it can cause chronic mucocutaneous candidiasis. So these are the important diseases caused by Candida. How to treat Candida? For the oral infection we give nystatin and azoles. Rarely we give echinocandins. For vaginitis we give oral and topical route of administration. For oral, we give fluconazole specifically, and for topical we give any topical anti-azole, anti-fungal medication. And for esophageal and systemic mycosis or systemic infection, we use fluconazole, echinocandins, capsofulgin, and also amphotericin P. So the next pathogen which causes opportunistic infection is Aspergillus. So in the Aspergillus, important feature is Aspergillus is septate, having septate hyphae, and the hyphae are at acute angles like 45-degree angle of the hyphae, branching hyphae. Next thing is Aspergillus causes causes invasive infection, especially in the immunocompromised, and also invasive in neutrophilic dysfunction, because Aspergillus is one of the catalase positive pathogen, so it can cause chronic granulomatous disease, which is a neutrophilic dysfunction problem, and it is invasive problem. So Aspergillus can especially cause aspergilloma, which is known as fungus ball. So if a patient is suffering from recovered from tuberculosis, so there is a post TB state or post TB or cavitation lung disease, so it can cause aspergilloma, also known as fungus ball. And there is a strain of Aspergillus which can cause aflatoxin, which releases aflatoxin, causing hepatocellular carcinoma. Also, there is association with the cystic fibrotic patients and also asthmatic patient. Aspergillus goes into the lungs, and there is an allergic hypersensitivity reaction in the bronchopulmonary part and causes aspergillosis. So there is an allergic bronchopulmonary aspergillosis, and in this and associated with cystic fibrosis and asthmatic patient, and it's an allergic hypersensitivity reaction, and it can cause bronchiectasis, and it's an allergic, so eosinophilia. So how to treat Aspergillus? So we give the treatment of choice is voriconazole, and if it is failed we give echinocandins. So this is Aspergillus, and then we have cryptococcal. So cryptococcal neoformans, very high yield, very much tested. The opportunistic infections are very high yield, they are frequently tested. So cryptococcal neoformans, first one, the feature heavily encapsulated. So in order to highlight or in order to diagnose it, we use India ink, which give the results of a clear halos, and also we give mucicarmine which gave a red inner capsule as a result. And also we give latex agglutination test, which is more specific and sensitive and specific, and it is against the capsule and it is antigen production. So latest agglutination test is detect the capsular antigen of the Cryptococcus neoformans, and it is very much specific and sensitive. So Cryptococcus, it is found in soil, especially in the pigeon droppings, or it's a clue, pigeon droppings, and cause it goes inhale, the person inhale, it goes into the bloodstream. As it is encapsulated, evade phagolysosome, goes into the bloodstream and arrive at the meninges and brain. So it can cause meningitis and encephalitis. And this encephalitis is very much having clue of soap bubble appearance. So how to treat Cryptococcus neoformans? We give amphotericin B, it is disseminated. We give amphotericin B and flucytosine followed by fluconazole. So this is how to treat Cryptococcus neoformans. The next one is Mucor or Rhizopus. So Mucor and Rhizopus, they are non-septate hyphae having wide 90-degree angle. Mucor and Rhizopus are very much common in especially mucormycosis is especially in the diabetic ketoacidotic patients and also leukemic patients. And it inhaled, route of transmission inhalation, it proliferate into the vessel wall, and it goes into the cross the cribriform plate and goes into the brain. In the brain it causes rhinocerebral abscess, frontal lobe abscess, and also it can cause cavernous sinus thrombosis, leading to the symptoms of facial pain, headache, and give a black scar, and may lead to focal neurological deficit. How to treat? We give first we did surgical debridement, and also we give amphotericin B, or we give isavoriconazole. So this is all about the opportunistic infection, and very much high yield, very much tested.